Hi, I'm Dr. CHRISTIANE Northrup, an OBGYN physician and authority on everything that can go right with your body. And I'm here to tell you how to use this knowledge to transform your health and to truly flourish. Heart disease is the leading killer of women over the age of 50, and heart attacks are twice as deadly for women as they are for men. The statistics, which don't need to apply to you, are the following. 1 in 2 women will eventually die of some type of heart disease or stroke, which is a heart attack of the brain, basically. In contrast, 1 in 25 women will die of breast cancer, which most every woman is afraid of, but she doesn't think about her heart. No matter where cardiovascular disease first shows up, it's present throughout your entire body because the blood goes all over. Though most of us wait until midlife to take steps to prevent or treat it, heart disease actually begins in childhood. The minute you learn to start shutting down your heart to avoid feeling disappointment and loss. In this video, I want to tell you how you can keep your heart healthy at midlife and for the rest of your life. So, what causes heart disease? Atherosclerosis, or cardiovascular disease, results in part from an accumulation of oxidized fat in blood vessels that calcifies and eventually causes blood vessel and heart damage. This condition underlies all coronary artery disease. It is responsible for the majority of deaths in the Western world. Strokes, which affect 90,000 women per year, can be likened to a heart attack in the head. Both heart attacks and strokes are caused by clogged or constricted vessels. The only difference is where the clogged vessels are located. It is accepted now that hardening of the arteries is caused by damage to the endothelial lining of blood vessels from free radicals. This in turn is caused by glycemic stress, trans fats, emotional stress, and micronutrient deficiencies. Let me explain what that is. If you have an avocado or guacamole and you don't put lemon juice on it, the avocado turns brown. If you have an apple slice and you just leave it out for a day, the apple turns brown. That is glycemic stress, that is browning, that is damage from free radicals, just so you know. And that's what's happening inside your blood vessels. Let's start with emotional stress. Emotions such as depression, anxiety, panic, and grief all have been shown to cause constriction in blood vessels. It's as though the endothelial lining of your blood vessels, and remember, you prick your finger, blood's right there. It's everywhere. That constricts the blood vessels everywhere. So it's like your cardiovascular tree is eavesdropping on your thoughts and immediately changing. This impedes the free flow of blood, and anything that causes constriction in your blood vessels makes your heart and your vessels work harder to do their job. I've seen happy, joyful women with high cholesterol counts, like 320, live healthy lives into their 80s and even 90s, while much younger women whose lives are characterized by depression, anxiety, or hostility, who might have a cholesterol of 199, have their first symptoms of heart disease in their early 50s, even if the cholesterol is 180. So that's that. Estrogen deficiency. The thinking around estrogen has changed dramatically, and it may not be the risk factor that we thought it was, but let me cover this for you. Researchers stopped the original Women's Health Initiative study because the findings were the following. Prempro, which is Premarin plus Provera, actually increased the risk of blood clots, heart attack, and stroke in healthy women. And 3 studies have disproved the estrogen deficiency link. The Heart and Estrogen Progestin Replacement Study, HERS, the Estrogen Replacement and Atherosclerosis Study, or ERA, and the Women's Health Initiative, WHI, all showed that estrogen replacement, at least with the things they were using, did not decrease the incidence of heart attack in women who already have heart disease. In fact, research showed that the risk was even increased for a while. However, when in your life you start taking hormone replacement can make a difference. In a 2006 analysis of the data from the Nurses' Health Study, they found that the nurses who began taking HRT near menopause had about a 30% lower risk for heart disease than the women who didn't use hormones. In comparison, nurses who started HRT 10 years or more after menopause showed no such benefit. There was no difference between those who took estrogen alone and those who took it combined with a synthetic progestin. The study also reanalyzed data from the Women's Health Initiative and confirmed that the risk of heart problems increased in women who began taking HRT 10 years or more after menopause, but those who started within a couple of years after their last menstrual period experienced an 11% lower risk of heart disease. 11% lower risk is not a whole lot. But even more striking, in the estrogen-only branch of the Women's Health Initiative, published in 2006, women who started HRT between ages of 50 and 59 had a 44% lower risk of heart disease. Even so, I still wouldn't prescribe HRT to everyone just to prevent heart disease because there are too many other factors that come into play, including breast cancer and stroke risk. Let's talk about insulin resistance for a minute. This is so related to heart disease. Insulin resistance is present to some degree in 50 to 70% of women in the U.S. There's an enormous amount of data that exists on the link between nutrition and heart disease. Diets too high in refined carbohydrates and too low in healthy fats that are also high in trans fats are a risk factor. These have an adverse effect on lipids and insulin. They set the stage for cellular inflammation, creating a predisposition toward hypertension, diabetes, and heart disease. This is known as metabolic syndrome. Depression is consistently linked to a high risk for heart disease in women and men. About 25% of women suffer from depressive episodes at some point in their lives, and women are more apt to suffer from depression than men. Depressed women are twice as likely to develop coronary artery disease. It's a very important independent risk factor. So, how do you keep your heart healthy? Diet and lifestyle factors are the best way to go about it. The famous Nurses' Health Study followed more than 84,000 women for more than 14 years. It showed that the risk of hardening of the arteries is very low in women who get regular exercise, who don't smoke, who eat a low glycemic diet, who minimize simple carbohydrates, that's sugar and starches, and minimize trans fats, and also who eat plenty of the right kind of fats, such as omega-3 fats, olive oil, which is an omega-9, and avocado, those kinds of good fats. The high carbohydrate, low fat diet usually prescribed for preventing and treating heart disease has exactly the opposite effect when compared to a higher protein, higher fat diet with exactly the same number of calories. The high carbohydrate diet has been shown to increase risk factors for heart disease for healthy postmenopausal women, and it includes contributing to high triglycerides and insulin and lower HDL cholesterol. High carbohydrate diets also trigger angina, heart pain, sooner, and they reduce exercise tolerance in patients with known heart disease because high insulin levels from carbohydrates can cause constriction of atherosclerotic coronary arteries. So what is the diet for a healthy heart? 5 to 6 servings of fruits and vegetables per day reduces the risk of stroke by 31%. Cruciferous vegetables are particularly good. That would be broccoli, cauliflower, Brussels sprouts, cabbage. Green leafy vegetables, kale, collard greens, romaine lettuce, all wonderful. Citrus fruits are very, very good. One study showed that women who ate just 5 large carrots per week lowered their risk of stroke by 68% compared to those who ate only 1 carrot per week. We need to reduce bad animal protein, and by that I mean grain-fed beef and chicken and that sort of thing, because you can get an elevated level of homocysteine, which is found in high amounts in animal protein, and it constitutes a higher risk factor for cardiovascular disease in those who are susceptible, and that's not everyone. At least 10% of the population has a genetic tendency for elevated levels of homocysteine. When high homocysteine levels are reduced, the incidence of heart attack is cut by 20%, and the risk of blood clot-related strokes is cut by 40%. The risk of venous blood clots, that's blood clots in the vein, elsewhere in the body, plunges by an impressive 60%. We also know that vitamins B12, B6, and L-methylfolate, that's biologically active folic acid, can help lower homocysteine. Have your doctor check your homocysteine level. It should be below 7. It's easy to test for. Eat fish or take fish oil or marine algae supplements. A diet containing fish oil or marine algae has been found to reduce the incidence of heart disease in a number of studies. Research shows that 3 grams per day of fish or other marine oil containing foods contains both EPA and DHA, and this protects the heart. It makes platelets more slippery and decreases cellular inflammation. Alternatively, you could eat 3 servings of cold water fish per week, such as salmon, mackerel, swordfish, or sardines. 1 4-ounce serving of salmon, and wild Alaskan is the best, contains about 200 milligrams of DHA. If you're a vegetarian and do not care for these fish, take high-quality flax seeds, ground up, or EPA and DHA supplements derived from marine algae. The usual dose of DHA is 100 to 200 milligrams per day. For other omega-3 fats, it's 1,000 to 5,000 milligrams per day, and you can get capsules that are good. Other foods that aid heart health include garlic. There's a very long history of use of garlic for the treatment of hypertension. In one pilot study, it showed that high doses of garlic, 2,400 milligrams of deodorized garlic per day, significantly lowered both diastolic and systolic blood pressure. Garlic appears to increase the activity of the endothelial cells that line the blood vessels. Those are the ones that produce nitric oxide, which relaxes blood vessels and increases blood flow. Numerous studies have also shown that regular consumption of garlic reduces cholesterol by 10% or more and lowers triglyceride levels by up to 13%. It may also inhibit platelet aggregation and blood clot formation. Look for garlic supplements with the active ingredient allicin. This substance is relatively odorless until it is converted into allicin in the body. Daily dose should be 10 milligrams of allicin, A-L-L-I-I-N, or a total allicin potential of 4,000 micrograms. You'll see that all on the label. Tea. Tea is another heart-healthy food. Both black and green tea consumption have been shown to have beneficial effects, again, on that endothelial lining of blood vessels where hardening of the arteries can start, unless you keep it healthy. So the tea helps to decrease the risk of stroke. It's rich in what's called quercetin. Some studies have found that foods rich in quercetin, such as apples, tea, and onions, also reduce the risk of stroke. 3.5 or more cups of black tea per day decrease the risk of stroke by 69%. So, when you compare that to the drug, what they tell you a drug will do, you can see that the tea and natural foods often have a far more robust effect that you almost never hear about. Soy and other phytohormones. Studies have shown that soy and other phytohormones, such as those found in Pueraria mirifica or maca, lower triglyceride and total cholesterol levels, including LDL, the so-called bad cholesterol, while raising HDL, the good cholesterol, even though they have their place. Soy has further been shown to reduce blood levels of such markers for cardiovascular problems such as C-reactive protein and homocysteine, which we already talked about. Some studies even document improvements in the width of arteries. This may be due to soy's antioxidant properties, which could prevent LDL cholesterol from clogging the arteries. Remember, it is oxidized LDL cholesterol that causes the problems. In October 26, 1999, the FDA approved the health claim that consuming 25 grams of soy protein per day reduces the risk of coronary artery disease. For more inspirational tips, visit my blog and explore drnorthrup.com, where you will find wisdom for the body, mind, and spirit. Visit often to discover the connection between your thoughts, beliefs, physical health, and life circumstances. And remember, despite what you've been taught, you are in the driver's seat of your health, and you have the power to make profound changes.